Secretary.
Dr. Gingrey.
Thank you, Mr. Chairman. Madam Secretary, when you spoke at the Democratic National Convention in Charlotte last September, one of the first statements you made about the Affordable Care Act was, quote, "But for us Democrats, Obamacare is a badge of honor because no matter who you are, what stage of life you're in, this law is a good thing. First, if you already have insurance you like, you can keep it." And I end the quote. I'd call this a red herring that misled voters, intentional or not. Now, perhaps had you known that millions would lose their coverage, families would face financial disaster, as one constituent recently told me, or that the exchange rollout would be plagued by the multiple delays we have seen, you would not consider it such a badge of honor. The fact is, your words and those of the President as he campaigned last year that if you already have insurance you like, you can keep it, seem to be directly refuted by the millions of cancellation notices already sent to Americans just in the past few weeks. Whether your statement was inaccurate or, as Mr. Hoyer said yesterday, not precise enough, it does strike me that millions of individuals who, by listening to speeches like yours, voted believing one thing, now find themselves without coverage and are now scrambling to find coverage in a marketplace that offers more expensive plans with fewer options. In response to my constituents' call for help, I created a portal on my website, no patches or fixes needed, that allows those who have experienced problems to reach out and tell me about their personal experiences. In just the last few days, my office has received dozens of complaints regarding increases in their monthly premiums. I received one such notice from a mother in her early 50s who just received a notice that not only will her insurance premiums double, but she will also have to switch insurers to keep her doctors due to the effect of the Affordable Care Act. Can you imagine receiving notices like this? I can tell you that just in my district, the 11th of Georgia, many more are experiencing this situation. Madam Secretary, this is akin to telling seniors that in a few weeks their Medicare coverage will be dropped or their premiums would double. Now, I know that neither you nor the administration would ever advocate for such a policy, yet here you are subjecting those currently in the individual market to such government intervention. And I would hope that you would agree with me in recognizing that these increases are a heavy hardship on my constituents, on all of our constituents, Republican or Democrat. Now I'll get to my questions. You know the health care law included a hardship exemption from the individual mandate, yet the administration has failed to finalize the application form for the hardship exemption 3.5 years after we passed this law. As of today, can an individual apply for a hardship exemption from the individual mandate on Healthcare.gov? Yes or no?
I don't know.
I do. It's no. On October 15th, Politico reported that if the online system for getting into Obamacare coverage is rickety, the system for getting out of the mandate doesn't even exist. HHS says it will take another month at least for the administration to finalize the forms for the hardship exemption from the individual mandate. Why has it taken 3.5 years to finalize a simple application form for an exemption from the individual mandate?
Well, sir, as you know, the individual mandate is not in place until next year. We have made it very clear that if somebody is Medicaid eligible in a state that doesn't choose
my last
Medicaid,
question in my last second. An estimated 16 million people in the individual market have or will receive cancellation notices stating their health insurance coverage does not meet minimum coverage requirements of the Affordable Care Act. The bill specifically grants you, Madam Secretary, the power to determine the criteria for a hardship exemption. Will you provide all of these individuals a hardship exemption since the Affordable Care Act is taking away their plan? Will you do that?
No, sir, and I think those numbers are far from accurate. 95% of Americans who have health insurance will be in a continuous plan, Medicare, Medicaid, employer-based, VA, 95%. 5% who are in the individual market, a portion of those 5%, a portion of them about 12 million people, a fraction of those 12 million, will have a plan that doesn't meet the criteria and has not been grandfathered in. They are indeed receiving notices. Many of those individuals, half of them, will be eligible for financial help getting a new plan, and they have many more choices in the marketplace. So we will not have a blanket exemption.
Sounds like a hardship to me,
Gentlemen's time has expired. Mrs. Christensen.